here are our numbers for today. 15,856 negative tests, 1,221 positive results, and we now have 14 deaths in the state of Wisconsin. The positive tests that's 109 more than we were at yesterday, and obviously that is an increase of one death over yesterday. That was of a male in his 40s. You can find these numbers as well as the county breakouts of this data on the DHS Outbreaks and Investigations webpage. Now I want to take you back to just about a month ago when Wisconsin had fewer than a handful of confirmed cases, and our state lab had finally received the test kits they needed from CDC to begin running COVID-19 tests here in the state of Wisconsin. They were quickly joined by the Milwaukee Health Department and have ramped up over the past month to a combined throughput of about 500 tests per day. In addition, a network of labs across the state scaled up, averaging 1,500 tests per day. And while there is no backlog of tests, we have prioritized healthcare and long-term care workers, hospitalized patients, and those at risk of the most severe disease from COVID-19, while continuing to work to expand our testing capacity so we are in the best position to respond to this evolving pandemic. To that end, we stood up a strike team as part of our statewide response that includes additional labs and industry leaders in both the private and public sectors. Just like during H1N1, we knew that testing for this virus would require assets beyond the state lab, and for this response, that has taken the form of a strong partnership between government and some of the best and brightest minds in business and technology. Lucky for us that we didn't have to look very far to find them. Our lab capacity strike team has welcomed the expertise and insight of leaders from Epic Systems, the Wisconsin State Lab of Hygiene, and numerous other state agencies to share resources, equipment, and knowledge to remove barriers and enable us to add to this next layer of capacity, which, as we announced earlier today, will initially double our lab testing capacity. These additional partners, all Wisconsin-based, include Exact Sciences, Promega, UW Health, and Marshfield Clinic. These companies are pulling together and stepping up to provide operational and resource support to one another to bolster our state's testing capacity. But I want to be clear, testing will still require a doctor's order, and these partners are not testing sites themselves. They will be receiving and processing the tests that are completed by healthcare providers. So while this is a critical step forward, it is important to remember something we have talked about a number of times before, that the supply chain for testing materials is extremely fragile due to this worldwide pandemic, much like the way the governor talked about the PPE challenges we're facing. So our new lab partners and our public labs will continue to be limited by access to the materials from their national suppliers and the federal government to complete these tests. And to that end, you remain a critical partner. We all need to continue to do our part to remain safer at home. Please continue your good hygiene practices. Continue to wash your hands often with soap and water. Cover your coughs and your sneezes. And when you leave home for your once-a-week grocery and pharmacy run, please exercise strict physical distancing. Stay at least 6 feet from each other. The more we all pull together while keeping our 6 feet physical distance, the better it is for all of us, and especially those on the front lines of our healthcare system, tending to our most severely ill friends and neighbors.